Diabetes ruined my life. With this feat, I won't be able to achieve my dream anymore. If only the treatment for it is easy and accessible. I wish it's easy to control my blood glucose level.
On my trip to Kampung Kalisari, an area around Puskesmas Pasarabo, the area in Jakarta with the highest diabetes prevalence in Indonesia, I got inspired with the condition there. Imagine the challenges of waking up each day uncertain about your health, a reality for millions with diabetes. It requires significant time, resources, and energy. Rigid work schedules, high cost of supplies, and limited healthcare access make daily glucose monitoring a significant challenge, making every day more challenging than it needs to be, leading to numerous death and disability cases. Indonesia itself faces challenges with non-communicable diseases like diabetes, with the diabetes mellitus prevalence rising to 11.7% in 2023, particularly among the productive age group. To address this issue, Diabuy comes to the rescue with an accessible CGM and a helpful application.
Currently, the most accessible tool for diabetes screening in Indonesia is the glucometer. It is affordable at around 18 to 19 US dollar. However, it is invasive, leading to limited usage and poor awareness of glucose level among diabetic patients. As the alternative here, we are massively enhanced the usage of continuous glucose monitoring, a minimally invasive tool that measures glucose levels continuously. It consists of three parts: small sensor, a transmitter, and a display device. So what are the advantages of CGM? It can continuously and automatically monitor glucose level. It requires only one needle per sensor applications. It provides alerts for low or high glucose levels and also promotes better lifestyle choices. But why does it have to be CGM? The truth is, only 21.4% diabetic patients in Indonesia receive treatment, and 80% of them are uncontrolled. Uncontrolled patients have higher risk of developing complications. Therefore, to prevent that, immediate awareness is needed to develop adherence in diabetes treatment, which can be done best by CGM. Right now, in Indonesia, CGM is more popular among type 1 diabetic patients. A 15-day CGM costs around 1 million rupiah, or around 60 to 70 US dollars, which is quite expensive. Thus, the main challenge is how to make CGM more accessible and affordable.
Let's take a look why Diabuy is a strategic move for our CGM approach.
So let me introduce you to Diabuy. First, who's our target? Our primary target is type 2 diabetic patients who use insulin continuously, as they are the ones who are prone to being hypoglycemic. And for patients who only consume anti-diabetic drugs, we will talk about it in the alternative plan section. Before we delve deeper into the app, we will give a video instruction to the patients in order for them to operate the CGM and app well. Coming to the app, we have several features. First is real-time data feature. Freestyle Laboratory has acquired automatic Bluetooth-based real-time transfer data to their built-in app, and the data can be used as grabs or integrated into the government's big data. Patients can also export the data to a PDF and let the doctor see the summary of the report. They can also find the nearest healthcare centers through the app. And what if they don't want to go to see the doctor directly? They can also contact the doctor through telemedicine from the app. We also have our reminder system that can remind patients to take the medication regularly, and it will be presented as notification. We also want to involve family as the support systems to improve the adherence of patients through the notification feature. And lastly, the education feature gives necessary information to the patient, such as which part of the body you could use as an insulin injection site. Sounds good, right? But what if the CGM plan doesn't work out? Do we have an alternative? Of course we have. We offer the second program called Adherence Program for Anti-Diabetic Drug Treatment. Initially, we targeted this for patients who only consume the drug, not in combination with insulin. The reason is because the risk of hypoglycemia in this group is lower compared to patients who also use insulin. what makes it different? Firstly, because we can monitor in real time like CGM, we can use smart cameras to detect if a patient is truly taking the medicine. It is integrated into the tracking system, so if the patient is not taking the medicine, there will be an alarm and notification.
By first, establishing a formal agreement clarifying the roles and responsibility of each party and the implementation and monitoring of the application with the government includes the addition of CGM to national health insurance coverage. Second is future integration to the Satu Sehat application. And third is data to be used for national health management strategy. And fourth is the Ministry of Health and Indonesian Medical Association to train the healthcare workers to understand how the tools work, to first educate the patient and to interpret the graph and the result, converting it as a clinical decision.
The implementation is divided into two parts. The first will be the integration of Freestyle Libre 3 sensor and the application, which includes several steps. The first step will be gaining permissions and compliance from Abbott as the manufacturer of Libre to integrate their data. The second step will be requesting collaboration on possibility of subsidized or assistance programs to make the CGM application more affordable for the community, with the criteria of the first one will be individuals or households with income below a certain threshold as determined by local economic standards, and the second one will be insurance coverage limitation. The next step will be establishment of Bluetooth Low Energy or BLE compatible development environment and connection to handle data parsing and notifications. And the last step will be the deployment of the app, ensuring regular maintenance for seamless real-time data display would also be needed.
Technological progress, only 3 notable CGMs are available in Indonesia. Cinecare with the lowest price point, as well as Dexcom and Freestyle Libre, both of which are not available in their newest versions yet in Indonesia. Freestyle Libre is promising not only for its price, but also for its 14-day lifetime. Its newest version also has the highest accuracy with more at 7.9%. Through subsidies, we aim to reduce costs as low as they are affordable in their origin countries, while maintaining accuracy and calibration-free comfort. Moreover, not all CGMs in the market provide integration with applications. In addition to real-time blood glucose data monitoring for adherence, medical report exports, caretaker emergency notifications, and physician interfaces, Diaby allows integration with local healthcare facilities in order to ease help-seeking behaviors in emergencies. Our AI-powered pill detection system is also novel compared to current apps that are mainly tailored for insulin users.
However, even if CGM held great potential within Indonesia's society, several issues might appear. First, technology barrier. The internet user in Indonesia are only 79.5%. It is apparent that there are lower internet coverage and connection, as well as accessibility of the gadgets and privacy and data issues. We will solve these challenges through collaboration with government and other parties to ensure the safety of the application and internet connection. Second, regarding the population condition, people with diabetes need to consult with specialists. We will provide a telemedicine feature, especially for people in rural area. And last one, regarding financial capability, we will inform the user about where can they get financial help or to access subsidized CGM.
We divided our 3-year plan to 3 main phases. First phase, tech development feedback loop. After deeper market research, we will pitch a collaboration with existing players, most notably Freestyle Libre. Diaby's sensor technology and app will then be designed and prototyped, adjusted repeatedly through feedback. Artificial intelligence algorithm models will also be developed through open source datasets and literature. Meanwhile, partnership formations will be started. Secondly, launch preparation in the second year consists of clinical trials assessing diagnostic accuracy, safety, and biocompatibility, app testing, and AI algorithm evaluations. Regulatory documents will also be prepared and submitted. With the foundation settled, our third phase is launching the app. Wider implementation is anticipated through marketing and various partnerships, including Satu Sehat, the existing Ministry of Health app. The app's impact on adherence will also be evaluated for further improvements.
Initially, CGM had to be imported from abroad. Its expensive price made the small market less attractive in the eyes of companies. As the benefit of this application increased public awareness on CGMs, the market for CGM usage in Indonesia is expected to grow, making Indonesia one of the countries targeted by CGM companies to establish factories, thus making the price significantly cheaper, boosting sustainable impact for beyond 3 years.
The following is a budget plan which estimate around $1 million to cover production up until maintenance. We also would like to convince you that the proposed budget has a higher potential to cover national health screening and prevent an increasing national budget in the future.